What factors could cause a false negative pregnancy test result for twins?
Hello everyone. In today's discussion, we're diving deep into the realm of pregnancy tests, with a particular focus on twin pregnancies. Have you ever wondered what factors could lead to a false negative pregnancy test result, even when you're expecting twins? If so, you're in the right place. Let's unpack this intriguing question together.
What is a false negative pregnancy test result?
To start off, let's clarify what we mean by a false negative pregnancy test result. This term refers to a scenario where a pregnancy test indicates that a woman is not pregnant, when in fact, she actually is. This can understandably cause a great deal of confusion and uncertainty.
How do pregnancy tests work?
Before delving into the specifics of twin pregnancies, it's essential to understand how pregnancy tests work. Home pregnancy tests detect the presence of a hormone called human chorionic gonadotropin, HCG, in a woman's urine. This hormone is released after a fertilized egg implants into the woman's uterus, which typically occurs about 6 days after fertilization. It's important to note that the HCG levels usually double every 72 hours in early pregnancy.
Why could a false negative occur in a twin pregnancy?
You might be wondering how a twin pregnancy could result in a false negative when, logically speaking, HCG levels should be higher due to 2 embryos. While that's correct, a false negative could still occur due to several factors. 1. Testing too early. Testing too early is one of the most common reasons for a false negative result. If a pregnancy test is taken before the implantation of the embryos, it might not detect HCG because the hormone hasn't been produced yet. Even though twins might mean higher HCG levels later on, testing too early would yield the same negative result as a singleton pregnancy. 2. Diluted urine sample. Another reason could be a diluted urine sample. The concentration of HCG in the urine can vary depending on the time of day and fluid intake. Using a highly diluted urine sample, for instance, after drinking a large amount of water, could result in a false negative. 3. Faulty test. Finally, the pregnancy test itself could be faulty or expired, leading to inaccurate results.
Are twin pregnancies more likely to cause false negatives?
While the factors above apply to all pregnancies, it's important to clarify that a twin pregnancy does not increase the likelihood of a false negative result compared to a singleton pregnancy. False negatives can occur in both scenarios, primarily due to the reasons mentioned earlier. So, there you have it. While false negative pregnancy tests can be perplexing, they are often due to testing too early, diluted urine samples, or faulty tests. Twin pregnancies do not inherently cause more false negatives. Remember, if you suspect you're pregnant and receive a negative result, try retesting after a few days or consult with your healthcare provider for further guidance. I hope this discussion has been insightful. Stay tuned for more health-related mysteries unraveled.